and welcome to the Scottish Dental Hygienist podcast. I am your host Natalie, and I have a super exciting episode which is in video with the amazing health and wellness educator Rose O'Donovan. And if you don't know Rose, then you need to get to know Rose. So hi Rose, nice to see you.
Hi Natalie, so good to be here.
And please tell everybody, who is Rose O'Donovan, what is she all about, and what do we need to learn from you today?
I'm Rose, I'm from Ireland. I've lived in the UAE for 13 years. I guess you'd call me a health and fitness educator. I work primarily with education, but my trade is personal training. I'm a master instructor for indoor cycling and power training, and a master instructor for Oxygen Advantage. I'm a tutor and assessor for Body Hack across all our personal training diplomas. And some of our neurology courses, and I work on a daily basis with lifestyle disease. I'm currently trying to finish my master's in obesity and weight management. So I've a lot of qualifications, but a lot of experience in the industry as well. So I guess health and fitness educator is the best title.
Yeah, that sounds amazing. I feel as if this won't be long enough to tell everyone what they need to know, but I'm hoping that we'll give some people some bite-sized information to take away so that they can improve on their day-to-day life, because breathing is so important, isn't it? And I never realised myself until I came to hear you speak at one of our study clubs, and I was totally blown away. And then, yeah, I'm so excited for today. So where will we start? Will we start with, tell us about your skill set when it comes to like your Oxygen Advantage training, Buteyko breathing, and how do you implement that with your clients on a day-to-day basis? How do you do that?
It's such a great question. I look at breathing primarily with people just in their breathing patterns. If somebody comes to see me solely for breathing, then we will only do breathing exercises and protocols. But in general, when I'm training people, and I guess it's important for the listener to understand, I'm a general populations person and I'm lifestyle disease orientated. So there's a lot of fitness and severe health and fitness in Dubai. And the reality is that most people live in the general population and lifestyle disease arena, and that's where my my wheelhouse or my toolkit is. And when I say I look at breathing patterns, it's in their exercise, their sleep, their day-to-day living, and how I implement it is across their training and across what they do in terms of their health and what their goals are. You know, when we assess why somebody comes to me or to anyone, what is the goal that they want to achieve and what's stopping them achieving that.
Okay, that's really cool. So tell us more about what Oxygen Advantage and Buteyko breathing is, because I think probably a lot of the general population don't really know unless they've taken a deep dive or spoken to me or spoken to you or spoken to anyone who are friends with us. So tell us a bit about it.
Buteyko and Oxygen Advantage, they both have a commonality in that they are functional breathing schools, and they are primarily for re-educating somebody how to breathe properly. So if we look at Buteyko breathing only, that would be breathing for children, adults, conditions like asthma, huge re-education of breathing properly and tools for things like anxiety, well-being, sleep. And then if Oxygen Advantage is all of that plus the sports performance side. So we start to look at hypoxic, hypercapnic training, where we're really driving sports performance and actually getting more efficiency out of the body. But always we're still looking at functional breathing patterns first and somebody's overall health. So they're quite similar, but there's almost like another school on the Oxygen Advantage, and that is it's founded by Patrick McKeown in Ireland. He's got over 25 years experience, maybe 22, 23, working directly with people, and that's where I took my education.
Okay, and how long ago did you do that?
It's I think it's as far back as 2017. I was introduced to Oxygen Advantage through Hiba and Yusuf and Body Hack. They were delivering a course and they mentioned the book, and I have one of the first oldest books, and I I bought it immediately and I read it and I was like, wow, this is so incredible. And I practiced on myself. And then I found somebody in Ireland said, oh, the education's here. And I ended up traveling 3 times I went to Romania, I went to Poland, and I went to Netherlands all before COVID. And I took the same course, which is a really intensive course, the full instructor course. And on the second or third time I met Patrick and he asked me to be a master instructor for him.
Wow.
And then I went to Ireland for a week. And I remember teaching breathing during COVID, and we were all online and nobody really knew anything about it. And when I was introduced to it, it really was a new thing, and people, it's after exploding now, so it's gotten very confusing for people. But I specifically had health problems that I couldn't address, and nobody was addressing them for me, and that's what kind of led me into it. And if you go into neurology, and a lot of the body hack courses are based on the brain and neuroplasticity, and breathing was always a fundamental part of that. So I think I took that concept and ran with it because I was also heavily involved in cardiovascular training, and it all made sense.
Yeah, it does. It just ties in all the dots. And especially like for my job as well, like people are so dysfunctional with their breathing, even me. Like I am a rehabilitating mouth breather. After I read Breathe by James Nestor, and then I also read Oxygen Advantage, it's totally blown my mind. So what I want the listeners to think about is why is breathing so important? Like why can't we breathe out our mouth? What is the problem with breathing out your mouth and not your nose? And does that have repercussions in the rest of your body, or is it okay?
It has massive repercussions, and I've been on quite a few podcasts in the radio, so sometimes I feel like I'm saying this over and over again, but people actually don't know, Natalie, that breathing through our mouth is just it's not the way it is. It's like we could eat or drink with our nose, but we don't necessarily eat or drink with our nose just because we can. So breathing through the mouth, 42% dehydration. It is extremely stressful to the body. And if the listeners are listening, open your mouth and take a few gasps or gulps of air through your mouth, and you will feel that vasoconstriction of the airways and the bronchoconstriction. So it just gets more and more stressful. With our nose, you've got a 20% increase in the resistance, and that, but 50% increase in air resistance when you breathe through your nose. That results in 20% more oxygen uptake in the body, especially in the lungs. And then you look at things like filtering the air, humidifying it, the microbial impact of breathing through your nose, and nitric oxide getting delivered, which can only happen through the nasal cavity. And breathing through our mouth it's just about the worst thing you can do long term for your health. So when we look at chronic lifestyle disease, there are over 200 of them, and they are all associated with mouth breathing. And the confusion is which came first. Did somebody start mouth breathing first and then develop type 2 diabetes? Or is it obesity and overweight and type 2 diabetes, or chronic cardiovascular disease? Which one is coming first? So the education on breathing properly has to really be implemented, more so now than ever, because our lifestyle has changed. We live downwards into a phone and the mouths are open. So I can't say enough about it. And one of the major things that is overlooked, especially in my industry, because it's not taught, is the mitochondrial health of the cells and tissues in the body. And this is what leads to long-term chronic illness. And that is what mouth breathing will do to people eventually. It's like choking someone.
Oh wow. Can you just explain mitochondrial health to people who don't really understand what that means?
So mitochondrial health is they're little cells inside our body, and they're called powerhouses, for a better word. And it's when we look at mitochondrial health, it's like the density of capillaries that are available in the body. And say somebody who's suffering from chronic heart disease, cancer, type 2 diabetes, they will have very poor mitochondrial health, which is linked to their aerobic function. And your aerobic function would be linked to something like your ability to move consistently over time, whether it's daily movement of just walking around the place, picking things up, going up and down the stairs, or when we take it up another level where somebody's able to consistently exercise. So this is delivery of blood to the tissues and cells, but in an oxygenated capacity.
Okay.
Now, if you're doing that with mouth breathing and you're under stress and your capacity is very low, your mitochondrial density will be low. So somebody struggling with lifestyle disease usually has a very low mitochondrial health of their tissues, and it is absolutely paramount. It's like, and even 15 minutes 4 times a week at 50% of your capacity can increase your mitochondrial density by 50%.
Wow, how amazing.
Yeah. And you know, when I say I deal with lifestyle disease, probably 70-80% of my clients are struggling with their health on a daily basis.
Yeah.
And the fitness industry can't deal with them because they just kind of beat them up and do things that are too hard. And I'm sure you see people like that because you have people who are coming in for dental work, they're mouth breathers, and there's a lot of poor oral health, for a better word.
Absolutely. The mouth breathing from our point of view is really dangerous because we're going to change the microbes inside, we're going to have problems with the teeth, we're going to have problems with gums, we're going to have bad breath, and then we're probably going to have gut health issues as well. So with all your clients, who is your typical client that comes in and sees you, and do you see a pattern with these types of people, or especially like here in the UAE?
I see, like I said, I see a lot of lifestyle disease. So I see primarily overweight and obese clients. Some are on medication, some are not on medication. So I deal with both routes, whether they're medicated for weight loss, which is now huge. Everybody seems to have an opinion on it. I see a lot of pain management. I also see a small portion of extremely fit females that need a lot of help with their breathing and with their lifestyle, because they will struggle with the same issues that people with lifestyle disease are struggling with because of breathing, sleeping, overworking, overtraining. A small portion of hormonal problems in women. I love that population because I probably fall into that population myself. And mainly the more I can help somebody, the more I tend to have them. And then a very small portion of people who are going off doing crazy adventures and they say, I want help with my breathing, and they usually come for Oxygen Advantage, the sports performance side of it. And I see a few kids for Buteyko breathing, and I usually have to send the kids off to people like you or Dr. Tina. Sometimes they go, sometimes they don't. But yeah, that's my client base that I would see.
Amazing. Okay. So say let's just look at one type of client then, just so that we can try and get like everybody who's listening to dial into that. So say you're fit female who comes to the gym all the time. What is her problems? What is she turning up to you with?
Diaphragm and pelvic floor issues.
Okay.
You know, there's too much fitness going on. They might be over breathing. So maybe not necessarily mouth breathing, but over breathing. They may be under. I don't want to use the term under eating, but they do not have enough nutrition to support what they're doing. So this is like a mechanism of stress in their body. There may be pain management from lack of good breathing and vagal tone in the body. I do loads of vagal tone work with people. And then people who've trained, like that fit female might be somebody who's trained a long time with a specific type of personal trainer, or in the industry where classes are based very much on that same sort of movement patterns that are quite old. So we start to move in different movement patterns like spirals, coordination. So we're activating different parts of the brain, implementing cardiovascular training that does look at aerobic function, and then trying to get the diaphragm and the pelvic floor just to start working optimally. You know, if women have had kids via vaginal birth or sections, there's going to be issues there. But there generally is a breathing problem in most people I see, and they're beginning to listen. You know, they are beginning to listen.
Yeah, I definitely feel like people are starting to waken up and see this. Even me, like we are not taught about this at all in our dental school program. And even when you look back, like being in the UK as a kid or as an adult going to the doctor, they check your heart, they check your blood pressure, they check inside your ears, inside your mouth, but they don't look at you breathing. Like, are you over breathing? Are you breathing through your mouth? Are you doing these short, shallow breaths up at the top? How anxious are you? So, yeah, I really feel that this is a huge missing puzzle piece that people need to wake up and listen, because it's really going to help with a lot of these chronic diseases that we're just collecting like Pokemons these days, no? Like all these autoimmune problems. So yeah, so move on. What type? So for me, right, I like a little bit of running. I do a lot of strength training because who my husband is. But how would, in helping with my breathing, what would be the benefit of me looking into my breathing more, like for me? Like, what do you think if I can control maybe not over breathing, breathing more into my diaphragm? How's that going to help me?
For somebody like you, I wouldn't touch your strength training because your husband is super famous. And things. There's certain things where I go, okay, we don't need to look at it there,
Yeah.
but we do need to look at it in your aerobic function. So getting you more efficient, and this is like the efficiency of the lungs. The lower lobes of the lungs can only be used when you are nasal breathing. So we probably need to pull back the intensity you run at. So if this is where people's ego really suffers, they're like, I want a certain distance, certain time, and I'll forsake my breathing. And it's like, no, we're going to peel back your timing, your distance, your intensity to get the breathing mechanism first and foremost. So I probably like look at markers like heart rate, HRV, your rate of respiration, the ability to nasal breathe well, and not like, because there can be good nasal breathing and bad nasal breathing where you're really, really struggling. And supplement your strength training with this really nice recovery training you can do. And then when you're ready, you can start pushing it up, and we can look at different breathing strategies when you want to run faster and harder. And running is quite stressful to the body as a movement anyway, because it's full gait pattern. You've got full limbs moving, and most people can't walk well, let alone run well, because of the dysfunction through the pelvic plates, the rib cage not working properly. We'd also look at your rib cage, Natalie, that you've got full expansion around the back, so breathing posteriorly, breathing laterally. If there's a rib flare, getting them more flexible. I'd also look at things like, say, just 5 to 10 minutes of breathing exercises, either pre or post training. I personally do one in the morning. I start with 10 minutes a day, and it really helps me. It helps centering, but it also helps diaphragm and pelvic floor. And somebody like you, I'll point out, you probably do a lot of talking in your job. So teachers, educators, therapists, when you're talking, you're naturally over breathing because you're taking gulps of air, and you can get to the end of a 7 or 8 hour day and not realize how much you've talked and how you have over breathed during that time. And you end up feeling exhausted, even though you haven't actually done a lot of movement. Would that make sense?
Absolutely,
Yeah.
absolutely. Sometimes after I'll work 9 till 7 p.m. for dental hygiene, and by the time I get home, I've got my eye, my twitchy eye, and I just want to lie down, and yeah, and it takes it. And if I don't sleep that well that night, then the next day I'm like in debt almost. Like my body feels as if it's trying to catch up. And actually, I've been doing it for a long time now, but I've noticed that mouth taping really helps me because I have a lot of myofunctional issues. So I don't maybe have enough muscle tone in my mouth to keep my mouth closed. So I find that when I mouth tape at night time, I can nasal breathe better. I get a much deeper sleep, and my body, I think, recovers better. Would you say that would be right?
That's 100% correct. And we do need to say it for listeners, you can't just pop tape on your mouth. You need to have your airway checked. However, if you know you haven't got obstruction of the nasal cavity, and say, for example, you snore, and you snore either nasally or
Oh,
from your
that's good.
mouth. So there's two different types. So that nasal one will be nasal obstruction from various reasons. But the mouth one, we can start to re-educate you to breathe better by using mouth tape. And mouth tape is something that encourages nasal breathing. And I would only suggest the myotape. I use what is micropore tape. I use the myotape also. They're nice and gentle. If you've never used it before, wear it for a couple of hours around the house. But it does encourage nasal breathing at nighttime, or if you are waking up with an open mouth or a dry mouth, that just means you're not getting enough air to your, or oxygen to your brainstem. Because there, like we mentioned earlier, there's no nitric oxide getting into the nasal cavity. You're over breathing and you're getting dehydrated, so you just wake up feeling exhausted. And sometimes people pop mouth tape on and they just fall asleep immediately, and they report having the best night's sleep ever. And it really, really is a good tool. But if you are someone who struggles with airway, deviated septum, that nasal snoring, get it checked first before using mouth tape. But mouth tape it's a wonderful tool. There's a lot of consternation on social media around it. So just know what you're doing, or speak to one of us first if you want to go and use mouth tape.
Absolutely, absolutely. That's really important. I wanted to talk about early development of children, and children who, especially over here, and my daughter was one of these kids, and I was one of these kids as well, I think. So these kids who mouth breathe, who have enlarged tonsils, enlarged adenoids, and maybe they don't develop well, or their development is slowed. How does breathing impact that? Like, can we improve on that?
You can definitely improve on it. And I just want to give you two statistics for the listeners,
Yeah.
because parents are under a lot of pressure today and they find it really difficult to work with this kind of stuff. So if there's nasal congestion, you're more likely to have ADHD in kids. 40% of children who experience sleep disorders will develop ADHD. And if they're snoring by 8 years of age, 80% of that population of young snorers will have a 20% brain reduction, or brain capacity reduction. So this is absolutely huge. So this is why, it's so simple to understand. You have a bad night's sleep, you wake up exhausted, you're not really with it that day. Cognition and that prefrontal cortex is not being used efficiently. And that's why after a really nice breathing practice, you actually feel like, wow, I can make better decisions. I'm not as stressed out. So it is easy to understand from a layman's perspective, but in terms of kids, this is really, really serious. So if kids are bedwetting, they have nightmares, they breathe through an open mouth, they wake up in tangled sheets, they're holding their breath, they're snoring, their breathing is audible, they have fatigue, they're sweating, that means they're not breathing correctly. And it should and must be corrected if you want the best health for your kids. And I, 100%, I understand this is difficult for parents. I had somebody say to me this week, they're like, no, this is too scary. And scary was the word they used. I was like, it's not scary. It's, there's nothing wrong with the child. They just need more help. And we're not living the same way we used to live. So facial development in kids is really important if you want a good looking kid. And I was one of them. My jaw grew down instead of going out and wide. I had 4 teeth removed that should not be removed. So I struggle with my aerobic function. I could be a lot stronger and fitter if my face was bigger.
Was wider,
like the back of your nose, if you draw your tongue to the back of the hard palate, all the way to the soft palate, that's the base of your nose. So you want the jaw to grow out and wide to support this, so that people can breathe through their nose. Now, if you've got your kids eating soft food and their jaw is hanging down and they're not swallowing well, they're not using this here. Exactly. So the posture is affected, so the head is forwards. It's called craniofacial development. By 12 up to 18, we have this development, but there are certain markers. I think it's like 6 years, 8 years, and 12 years. This really needs to be looked at. And your jaw is the strongest muscle in the body. The tongue is the most flexible. So this is why things like humming and singing, gargling, and lots of exercise for kids is really necessary. And the children's aerobic system and anaerobic system develops at a different rate to adults. So that's why kids exercise in short bursts and then they stop and they recover. It takes a long time for that to develop. But kids are not developing anymore because they're sitting in iPads and phones. And I know it's hot here, but it's not an excuse because it's cold somewhere else. So we must actually have education for breathing with kids. And I think parents find this scary and overwhelming because it's so new. This was
Exactly.
not, this is not a disease they have. It's not a disorder. We didn't know what we know today, and it's been around for years. It's just gotten worse with how our environment has developed. So parents should be open to the education on breathing and jaw development and brain development, and taking away all those lifestyle disease factors that are a risk later on for them.
Yeah,
I feel
absolutely.
like I'm rambling on a
No,
bit too
not at
much.
all. So, like, see for these parents, like for me, for example, with my oldest daughter, before she had her adenoids and tonsils out, what if you had a mum who came to you and explained that these were the symptoms of her child? What sort of things could they start, and what age would that be? And like, so what tools can we give these parents that they can start today to try and help?
They can start really young. They can start like 3 or 4 once we've got communication
Yeah.
barriers there. If they're a toddler or a baby, then that lip seal, just doing a lip seal with your hands after they've fed from either breastfed or from the bottle, so you can start to immediately make sure they've got lip seal. And then if they're a bit older, so correct ABCs, always breathe correctly. And we can start with a water test, get them to hold water in their mouth for 3 minutes to see that they can actually breathe through their nose, and keeping their nasal passage clear. So educating them from a very early age of clearing out the nasal passage. Try to avoid steroids, they are too
Yeah.
young. So clearing the nasal passage, checking their airways clear, and then doing something like a steps exercise. So they
Okay.
might either hold water, or they might pinch their nose and hold and pace 10, 15 steps and see how many they can go. And then they have a chart and they can keep adding to that. That is something they will probably need to talk to me one to one and say, how do I do this to make sure they're doing it safely and correctly? Breathing, breath hold steps. We've got lots of exercises for kids, but also just teaching them that chewing. The other one is major, major, major one with kids is to look, are they taking gulps of air when they're chewing? Are they picky eaters? Are they throwing their food out? That's a sign that they're not able to nasally breathe, when they're not able to keep food in their mouth and actually chew it and swallow it. And when they're swallowing, that not all the face is scrunching up,
Yeah,
that they're using the muscles here. So it's a
absolutely.
nice, easy swallow, and you can spot this, kind of a million miles off,
Once you
through,
draw
I
your
guess,
attention
your
to it. Yeah.
yeah, yeah, and it's just, it's easy to implement it once you know these easy steps, but it would be definitely making sure the kids' nose is working correctly, and then at nighttime as well, maybe sealing up their mouths to make sure they're actually sleeping with their mouths closed.
Yeah,
Yeah.
absolutely. So you were talking about like nasal cleaning. So for my girls, I we use like a saline rinse and these soft little syringes that we use at bath time, and the stuff that comes out. But my gosh, like even when I started doing it, I was like, oh my goodness, I can breathe so much better. My sleep on my like these smartwatches, I don't think the data is 100% accurate, but I definitely see an increase in deep sleep, REM sleep, because my nasal passage is a lot clearer. And then when I wake up in the morning, I just feel more refreshed, more energized, my body's recovered. So, yeah. So, is this something that you would recommend for children and adults, or nasal rinsing?
Both,
Yeah.
yeah, both. I think it's it's not for India and yogis anymore. We need to clean our nose, and part of that is getting the snot out. People are really they try to pull it back in, and it's like blow it out. It's meant to come out. There's
Yeah.
I can't remember this, the data on how much mucus is in there, but it's a lot, and the sinuses hold a lot. So when you do start breathing properly, correctly, or correcting strategies, or eliciting vagal tone in your body, you can actually find there'll be a lot of mucus comes out, and that can be scary for people. But it's just like a detox. So the nasal syringes, and I know there's lots of different ways of clearing the nasal passage, and there's loads of YouTube videos and Instagram videos. So any one of them to definitely use, and on a regular basis, just the same way we clean our teeth, we clean our nose.
Yeah, definitely. So you've spoke about it a couple of times now, vagal tone. So tell us, for the people who don't know what the vagus nerve is or what vagal tone is, and how it impacts your life, and how, if it's not working correctly, what happens.
So the vagus nerve is the longest nerve, or the 10 cranial nerve in the body, and it's got a ventral and a dorsal vagal area to it, and I'm not going to go into that, but it basically vagal tone, or the vagus nerve. It's your digestion, it affects hormones, it's your fight or flight response, your parasympathetic or sympathetic drive in your body. And when it's not working, somebody is highly stressed. So somebody who's exercising way too much, doesn't sleep well, smokes, drinks, overweight, chronic stressfully, either a work environment or relationships. So the vagal tone, the best way you can actually get better vagal tone in your body is by doing slow breathing. And if you've got good breathing patterns, somebody who mouth breathes would have a very poor vagal tone. Anyone presenting with trauma or sickness or illness, vagal tone and HRV will be really low. So in a lot of clients that I see that carry a lot of weight on their bodies and have been chronically stressed for periods of time, present very low HRV, very low vagal tone. And when somebody has high vagal tone, they're generally safe, they're generally chilled out, they feel good, they're able to take a poop, their digestion is good. It's another area people are really cautious to talk about. They're like, no, my digestion's fine. If your digestion is not fine, you do not have good vagal tone in your body. So the rest and digest state is really important. Things like good social relations, humming, gargling, good breathing patterns are all associated with good vagal tone. A sense of community, that you enjoy things that you do in life, and a sense of purpose. So it's not just like, exercise well and activate the diaphragm. There's a whole combination. And then if we look beyond the vagal tone, Natalie, because I know you deal directly with the gut, or not the gut, the microbiota of the mouth. If you look at the gut microbiota, this is like really linked to vagal tone and to the gut-brain axis.
Wow, it's so amazing.
Yeah.
It's so interlinked, and I just feel that we don't make these connections enough. And everybody I see stressed, I feel as if this word is like not a good word for people to, because as you say, they get quite defensive when you talk about certain things. So I tend to ask them, are you busy? How busy are you? And they're like, oh yeah, I'm really busy. And I'm like, okay, they're stressed. So you mentioned like humming and gargling. So is this something that we could do, like everybody could do on a daily basis to try and improve our vagal tone? Or what exercises would you suggest? Apart from, you said slow.
Yeah, it doesn't have to be another, like, oh, I have to do this. So I always try to fit all these exercises into somebody's life. So if you're driving and you like music, humming naturally makes you close your mouth and gives you nice vibration patterns to both the nasal cavity and the throat and this whole area here. And the louder you hum, the better. So I always think of like back in Ireland, and I'm sure it's the same in Scotland, you will see painters. They're very happy.
Oh yeah.
Away painting, and they're very happy, very healthy, no major issues. So humming, and then you'll have the same. It's in research documented on people who pray, and the when people pray a lot, because there's humming involved in that.
Okay.
And because it's like that long exhalation. So humming helps. Gargling is absolutely fantastic as well. And if you can find easy things that you can do, laughing is another really good one. If you can find these small things that you do regularly to increase vagal tone, things like inflammation will start to decrease. And I'm not going to say it's magic, just start humming and inflammation will decrease, but inflammation in the body crosses the blood-brain barrier from the gut. And improving things like socialization, your relationships, closing up your mouth, breathing through your nose, slowing down a little bit, like the ability to say no and just cross things out of your schedule, and then taking time to actually sit in a nice posture, either praying or humming or singing. And like, people don't sing, the choirs are gone, all these old things, and they're actually in research that it was really good for people's airways. So yeah, I say gargle in the morning, hum when you're in the car, because you can't always find time to fit in yoga classes or whatever it is. It's these things. Bouncing also really helps vagal tone. So gentle bounding, and that allows your body's fascial tissue to get rehydrated.
Amazing.
And it centers you. Yeah. And it's just letting go of that chronic tension and stress that might be gathering in the diaphragm or the pelvic floor.
Wow,
Yeah.
that is these are simple things that we can just do. Like that's really good that you're trying to implement them in people's like day-to-day tasks, and it's not adding to your list because that's obviously just going to stress people more, aren't they?
Yeah, I'll add a few things about
Yeah,
the vagal tone before you go off that. Chronically or constantly changing your wake and sleep times affects vagal tone in your body. The same with your meal times. Vibration and cold are really good for waking up a vagal tone. And I'm trying to think, upsetting your gut as well, constantly disrupting your daylight patterns. And this is something that goes on a lot. I see it a lot with, it's a really good question to ask somebody is, do you have a bedtime?
oh,
And people usually don't.
no, they don't, do they? No.
Consistent, the brain and the body loves consistency. So even if we do correct breathing and you want to look at gut and gut health, and the microbiome of both the mouth and the stomach, and actually get the brain back on board because it's really important, you're going to have to look at kind of other healthy patterns and not necessarily more training or some magic answer somewhere.
Absolutely, absolutely. And then, like, with the going back to, so obviously, when we think these young children and they're not chewing properly, we need to get these kids eating harder foods. And then, even as adults, we need to get them eating lots of colour, lots of prebiotic fibre that's just going to feed the microbiome. And if they're breathing well, the digestion's going to be better, microbiome's going to be better, inflammation's going to be lower, sleep's going to be better because our breathing during the day is better. So then this should have a knock-on effect at night time. Would that be right?
Absolutely. Yes, absolutely. Don't eat before bed. Digestion is, as soon as you put food and especially processed food into the body, your breathing changes. You literally can see somebody mouth breathe after they've eaten processed food. When they overeat processed food, this is chronic. In what it does, because the body's, it's basically not good for us. And I'm not going to say, oh, don't have this or that. I can nearly hear people say, they're against what we're saying. But when you overeat, when you eat at nighttime, this disrupts breathing, this disrupts sleep. And then if you do that long enough, imagine feeding a child processed food long enough close to bedtime, we'll start to look at neurological conditions that are linked to all of those, and things like depression, anxiety. That's where they originate from, poor breathing mechanisms in the body, because we go back to the cellular respiration, the cellular health, and the mitochondria.
Yeah.
So
Okay.
things like paying attention to proper hard food, stuff that will feed your gut microbiota, and keeping processed food more to a minimum,
Yep.
and then ultra processed foods. They we don't have data that supports them for health,
No, not at
unfortunately.
all. Not at all.
They taste good at the time, and that's about it.
Yeah. So you spoke
Yeah.
about anxiety there. I've read about this as well. So people who mouth breathe, are they more anxious or can they not? Like short, shallow breaths and anxiety and asthma, is this all linked together with breathing?
They're best friends. So
Best
somebody
friends.
who's best friends, yeah. Anxiety and mouth breathing will be best friends. So if you know someone who's anxious, just look at their breathing or listen. When you hear someone's breathing, this is a direct sign that they may need to, be educated about slow breathing, maybe even swallowing patterns so they can keep their jaw closed. They'll go to a psychologist or a psychiatrist who will never look at their breathing. And then if you're breathing poorly during the day, most likely are breathing poorly at night. But most anxious people need down regulation of their breathing, and they are chronic overbreathers. And it literally does make you feel more stressed and more anxious. A lot of people who hyperventilate, I mean, that's complete stress and anxiety. And it's almost like the opposite with depression. You need upregulation of the brain and the central nervous system.
Okay.
So sometimes like stronger breathing exercises are better for depression. That's why exercise works so well for depression,
Wow.
because it's that boost of BDNF to the brain, which is brain-derived neurotropic factor.
So,
And the only way we can get more of that in the brain is to actually do cardiovascular training. However, if you suffer from anxiety, then you definitely need to be
More
nasal breathing
down.
during
Okay.
your exercise,
Okay.
and doing slower, more controlled things with the mouth closed. And there's quite a few strategies I use in cardio training, like I will use nasal dilators, I'll use water in the mouth, even the Myomunchi tool, I'll use it. I will test somebody to see where their RPE and their actually cut-off points in their aerobic and anaerobic sets are, so that we're not overtraining somebody. But anxiety and mouth breathing and over breathing go hand in hand. So it's something that needs to be, yeah, looked at or educated on.
This is just like information we should be like, this should be common knowledge. Like, if you have anxiety, you need to downregulate. If you are depressed, we need to upregulate that body, get you moving
Yeah.
more. Because all we, or I mean, especially in the UK, a lot of the people who I used to see, they would all be on antidepressants, cholesterol tablets, and high blood pressure tablets as well. And probably if we took a step back approach and just maybe treated their breathing first, and then before we gave it medication. Obviously, that's not our field, but I feel like the breathing part we're just missing completely. No.
Yeah, if they looked at breathing and movement, so interoception would be another area for gut-brain axis and improving vagal tone. And interoception is the sense of your feeling of your body or your coordination. So if we looked at somebody and said, okay, if they are chronically depressed where they cannot leave the house, cannot get out of bed, yeah, they are going to need medication. But then we also look at breathing and movement and exercise, because it is not looked at, and we're moving less than we ever did because we are more automated than we ever were. And the same with anxiety, and mental health conditions are on the increase. And taking medication like statins, cholesterol, there are huge side effects to them. Plus, with antidepressants, there is a lot of data supporting the weight gain that happens as a result of taking them.
Okay.
And what happens when you gain weight, Natalie?
Oh, you don't
You get
feel
more
great. I
depressed.
know you don't. I
No, you
know.
don't feel
Oh,
great. And it's not my place not to say take medication,
of
but when you
course.
do take them, there should
Yeah.
be a plan in place. How long are you going to be on this for? Some drugs are lifetime drugs, but
Yeah.
a lot of drugs, this should be like for something acute, chronic, or to get you out of a situation. And that can we look at a holistic approach of keeping you healthy and well.
Yeah. So maybe is there some things that say that type of person who's listening and they really suffer with stuff like that? Maybe what is the first thing that you would suggest for them to start doing?
Um, Introduce some structure in their life
Okay.
first. So if we were talking about mental health conditions, structure of daylight, structure, talk to somebody who can advise them on exercise. Do actually assess their day mouth breathing. 100% would be the first thing. Are you a mouth breather? And then they might need to see someone like you, or they might need to see someone else that's in our field of expertise. And then, it depends which area they come from. If they're like the over busy, anxious person of slowing down. Simple breathing exercises, like I've got a couple that I really love. I always talk about the 5-10, where you hold your nose for 5 seconds, you breathe normally for 10 seconds, and you do this for 3 to 5 minutes. Everybody can do this.
Okay.
Anxiety, asthma, pregnancy. It's a very safe exercise. So you inhale, you exhale, you pinch and hold for 5.
Right, can
You
you do
breathe
that
normally
with
for
me
10
just now
seconds.
then? Can we try it?
We'll do a couple of rounds. So
Okay.
you're going to take an inhale through your nose and an exhale through your nose. And she takes a nice big inhale. And then on your next exhalation, you're going to pinch and hold your nose. And you're holding for 5, 4, 3, 2, 1. Let go to breathe normally. And you're just going to breathe normally for 10 seconds. Normal breathing is whatever breathing pattern you have in and out through your nose. And in another 3 seconds, you're just going to inhale, exhale, and on the exhalation, pinch and hold. And you're holding for 5, 4, 3, 2, 1, and let go. And we would do that for 3 minutes, Natalie. And what you would find is an increase of saliva in your mouth. You might have your extremities get warmer, your fingers and toes, and you'll have your eyes a little bit more watery. And it's just your parasympathetic nervous system activating. And then I'm conscious at times. So the one other that I really like at the moment is alternate nostril breathing.
Okay.
So if somebody has like blocked sinuses or pain all through one side of their body, or the injuries are here, I suggest either warming up with one of their nostrils blocked, so you can march on the spot, you can be jogging, you can be walking on the treadmill, or you can just sit
Okay. Okay.
and breathing in and out through one nostril, or you can simply alternate where you breathe in and you're breathing out. But I generally do the block side for people.
Okay.
And if there was another one that can, closing your mouth and going for a walk. If there's somebody who's highly stressed, go for it. And this means also that you're not on your phone, you're not listening or talking, taking voice notes or phone calls, or you're not yapping to a friend beside you. You go for a walk, you focus on breathing in and out through your nose of your surroundings, whatever's around you, and it really, really helps. Or if you're training and you want to get more recovery, you do 15 minutes of CV exercise with your mouth closed, because when you go into gyms, you look at everybody like this,
Or on the
and
treadmill.
it's not healthy.
Yeah,
Yeah,
constantly.
yeah.
Amazing. Now, these are really good things. I think there's a couple I'll implement more in my life, I think, as well. But yeah, okay, so let's touch on sleep. So, how does breathing affect your sleep? Like, tell me.
If you're breathing poorly during the day, you're going to breathe poorly at nighttime. It's as simple as that. And we've talked a little bit about sleep. You're going to wake up exhausted. So you'll have things like sleep breathing disorder. You'll have sleep apnea. You'll have snoring. So sleep apnea is where the airway is like literally shutting down for a certain number of seconds, a certain number of times over per hour per night. This needs to be assessed in a medical environment. And then if it's snoring, like I said, you can check, are you mouth snoring or you nasal snoring? We can close up the mouth and re-educate you to breathe, and most likely you'll need to do some myofunctional therapy for the mouth if the tongue is really low. And then you can have sleep that's just disturbed from very poor diet, eating too much too late at night, a hormonal state of male or female. Generally, it's more female. And then what I have noticed with a lot of people is they might need to check how they grew up sleeping. So we've looked at correcting your vagal tone, and you have nice diaphragmatic breathing, and you're doing all your breathing exercises, and you're healthier, but you're still struggling to sleep. You might need to look at what you did when you were a child, because there's a big link now between how you grow up and how you are as an adult. So especially if you've got kids today, regular sleeping patterns are important. So if a child goes to bed at all different hours, or they come from, a disruptive home where they're not peaceful, or a disruptive environment, you can imagine in this political situation how somebody grows up in a war-torn country. These will actually manifest much later in life, or if there's trauma that is not dealt with properly. So I see a lot of older adults, and they're consistently not able to rest. And this may not be a breathing issue; it might be something that needs to be looked at psychologically if the breathing issues have actually been taken care of. But mostly it's lifestyle and messing up the whole structure of sleep and wake patterns and dietary influences. And then if you are, like we said, any one of the above, sleep apnea, snoring, mouth breathing at nighttime, you will be chronically exhausted. And then trying to exercise on top of that is just nuts.
Yeah, your body's just going to be so stressed and you can't recover and you won't be sleeping well, and it just sounds like a bit of a recipe for disaster. Eh?
Yeah, and we've given all the solutions: nasal clearing of the nasal passages, mouth taping, exercising your mouth through myofunctional therapy. You can go to Natalie for that. If somebody's very poor, I'd send them swimming. Swimming's about the best exercise you can do for your face and your nose and your nasal cavity. I've just finished Tour de Welfit in Welfit, where we were doing a Tour de France replicated of indoor cycling, and I only teach indoor cycling once a week. Everyone thinks I teach a lot more, but I don't do it because I have to talk and exercise at the same time. That's chronically bad for my airway. So even though social media paints a different picture, I teach once a week.
Wow.
And then if I'm training, I would generally train with my mouth closed, And now that that event is over, because we were doing crazy, crazy stuff for the last month, I will be swimming for the month of August. And that is a really good way to train your airway, and you'll sleep like a baby after it.
Wow, that is so cool. Amazing. Like I never even realised that. Now that you say it out loud, when you're teaching people, when you're cycling and you're trying to talk at the same time, your body's going to be under so much stress. So
Yeah,
yeah.
any presenter, any physical presenter, any fitness instructor, your diaphragm is literally locking up. It's a huge practice to actually let go of the diaphragm, speak, present, and move at the same time. So we see a lot of
Wow.
fitness professionals who are inflamed and overweight and struggling, and they don't have the information that you actually should be doing breathing exercises and a breathing practice before or afterwards. And I think that's why I do my morning breathing practice. And the breathing diabetic is a brilliant person to follow. I consulted with him when I was struggling recently with my own breathing, and I
Okay.
said, I feel like a fraud. I know everything,
Oh.
but I'm not doing anything. And yeah, he gave me such valuable tools to use. And it's, I would say to anyone who is struggling, find someone you trust. It's not woo woo. And start to get proper education on what you need, because most people will know, is it a mouth issue? Is it sleep? Is it
Yeah.
during exercise? Is it the diaphragm and pelvic floor? They feel nothing. There's so many people say to me, I don't feel anything. I've no feeling. And, that's going to take time to sort out.
Yeah. It just shows you like everything that you spoke about there. It's like such a team approach. There's so many people involved, and it's not like a one visit thing, and people really need to be invested, and it's not something that we can fix overnight. But the advantages of doing something like this is going to be exponential. You're going to sleep better, you're going to feel better, you're going to have better social connections, your children are going to be healthier, smarter, faster, stronger. Like the benefits are
Better
endless.
looking.
Yeah, better looking,
Yeah.
yeah. It's totally a byproduct of breathing well, which is great. That's really
Yeah.
what the body was intended to be like, and we've just fallen away from the way things should be, the way Mother Nature intended, with our ultra processed diets, the air quality, how we just cannot breathe properly. So this is amazing.
And
This
just
is
the unwillingness to move.
yeah,
There's
yeah,
everyone's in the
yeah,
car. They won't take the stairs, skip the elevator, take a couple of flights of stairs. I mean, the unwillingness to do stuff today is a remote control for everything.
yeah.
Yeah, and it's, there's no magic tool. I have to say this all the time. It's like, it will take work. And I get a very common question: how long do I have to do this for?
Like
How long do you have to eat vegetables for?
forever. Yeah.
How long do you need to clean your teeth for? It's forever.
Yeah,
You're
I get that
you're either
question a
in or
lot as
out.
well. How long do I need to do
Yeah,
that for? I'm like, well, every day for the rest of your life. If you want to be
yeah.
happy and healthy, yeah, I know it's a big commitment, but yeah, I think you've really explained it really, really well. And so, what are we? So let's recap. What are all the things we can do, for everyone? So you can run through them for me. So we'll do, yeah.
We'll start with assessing your mouth health, because I'm talking to Natalie. It's like, I'm even going to you next month when I get time for my busyness.
Schedule, I know.
So yeah, so assess your mouth health, assess the oral health, and assess if you're not a mouth breather, or how you are breathing during the day, during sleep, and most of all during exercise, because it's hard enough to find the time to exercise. You want to make the most of that. Then assess something like, diaphragm, pelvic floor, vagal tone. Are you actually relaxed? Have a look at the bigger picture, your diet, relationships. They are actually stronger than diet for healing the brain gut axis. Of course, I'm in the diet and exercise field, because that's where I work. But the quality of your relationships is a stronger indicator or healer. It's been shown in research. Looking at the total stress environment of what you're doing, and then implementing really easy practices if you need to. Some people don't need what we're doing because they're already healthy and well. And sleep will be one of the major ones. And then if you are suffering from lifestyle disease, or somebody who is, or they're on medication, you really need to look at, multidisciplinary care. This is what I do hugely when I work with people on GLP medication. You need multidisciplinary care to take care of your health, and that is dietary advice, exercise advice. And if it doesn't feel good, if you don't feel good after exercising, it's not good for your nervous system. So the type of
Ah,
movement, the intensity of the
okay.
movement, you can do simple biofeedback. If you're stiffer and chronically in pain after exercising, it is not good for you. So it needs to change, and that, breathing will be also a part of that. Yeah, there's so much people can do. It's amazing. It's like there are so many answers, and just have an open mind. Be more open to the education that's on the market now, and taking control of your own health as well. And yeah, anything I haven't covered, you can add in.
No, I think like that. I think that's really good information for people just to take away and work on straight away, or find the right people. And say somebody wants to come and work with you. Where do they find you? And yeah, where are you working?
You can find me in Joint Space on Tuesdays and Thursdays. The other days I'm booked for I work in Sharjah. And then if you want to take education, look up Body Hack. They're the best health and fitness education. Hiba and I are teaching a full day's breathing certification in August. The Oxygen Advantage full instructor certification is available in November. And yeah, contact Join Space if you want a one-to-one, where I generally say to people, I give you as much information as I can to take away. And then a lot of people sign up and they train for long-term, where they actually do start to do things like, lose a lot of weight or become healthier or learn to move properly, and or they're breathing for some. I've got a couple, like I said, crazy sports people who are doing, ultra marathons and
Wow.
climbing mountains, and yeah.
Okay. So you really help everybody from one scale to the other, which is so amazing. Yeah, I feel as if lots of people will really value your knowledge. So thank you so much today for sharing and spending the time with us today, which was so good. I love all this chat.
Thank you so much for having me. And yeah, one of the number one things I would say is go to a dentist or dental hygienist you trust,
Yeah.
because that was part of my own journey. It was like my breathing was fine, but I had to find somebody. I was like, I'm terrified of what's been done to me before. Find somebody you can trust, because our mouth is, it is crucial to the rest
Yeah.
of the body. It's the gateway for both the brain and the gut and the stomach. So find Natalie and Dr. Tina, and we've got there. I'm sure you can list them in the notes. There's a lot of people, even from mothers taking their kids, rather than going to a doctor who's just going to give loads of medication. There are more answers, and there's better ways to do things. But it's been a pleasure talking to you, and thank you so much for having me.
No, it's so good. Okay. So let's tie that up there, and I will put Rose's details in the show notes. And if you need to contact her, we'll put your Instagram there as well, and the information about Joint Space and Body Hack as well. Super. So that's us for today. And yeah, thanks so much, Rose.
Thank you.